Hi everybody and welcome back to the channel, and today's video is a very quick guide on exercise management for tennis elbow. So the first series of exercises are the use of isometric exercises. We don't always have to use isometric, so if the patient is quite comfortable doing the isotonic exercises, obviously we don't need to go backwards to do that, but the patients that I see generally really struggle with the isotonic exercises, so we need to bring it back a little bit. So the first one I generally do is I will stand side on so you can see. I will put them in this position and I will put them in slight wrist extension and put pressure at the level of the wrist, and when that's okay, at the level of the MCPs, as that's okay at the level of the fingers, and keeping that pressure on, we can then move through range. If that's easy, or as it gets easier, we then do the same thing, but this time in pronation. So again, in this position, slight wrist extension, isometric pressure at the wrist, then at the MCP, and then at the fingers through range. As things become easier, we can then sort of progress. So we can obviously use weight. We can also use isometric holds in this position. So slight extension and keeping it there. So which could be a progression from the first. Obviously, as that gets easier and we're doing isotonic, we can then start to go through range. When we're moving on to the isotonics and the progression, you can start off with your arm like that, your wrist slightly extended, and then as you are extending the elbow, flex the wrist, and then supinate, come back up, pronate, slight extension, and then down again. We also need to consider the supination and pronation. So using this stick, we can actually start to do supination and pronation. Obviously, the closer you are to the centre and higher up, the easier it is. So starting off nice and slowly. As it gets easier, you can obviously go to the end or use weighted, such as hammers. And you can as well do it with a straight arm, just making sure you're looking at the elbow crease to make sure the movement is coming from the elbow. Imagine now I'm doing a shoulder press. Sometimes that position can irritate it, so again, have it in the neutral as you go. And I also, obviously, like I said, use the Kinetic Chain. So if I do sort of side on, and I will put this in this hand so you can see. So you can either do a little bit like a push press, so you're in a squat, and then up. So a bit of a squat and then up, or you can go into tiptoes. So you're coming up and then down. Another part of the exercise program that we shouldn't neglect is the strengthening of the scapular stabilizers. There's a few different ways of doing this. The first one is in standing and with the elbows on the wall, coming up, squeezing your shoulder blades, taking your arms off the wall. The other two positions, you can take your arms up into the Y position, thumbs up, and then just squeezing your shoulder blades, and then bringing them down to the T position, and then squeezing your shoulder blades. You can also, in this position, you can also do the scapular exercise, so they sometimes call it the serratus punch, so reaching up. If this hurts the elbow because of obviously quite a wrist-to-wrist elbow, you can always try and put the wrist in neutral. This short video has hopefully given you some ideas to treat the really acute tennis elbow and then progress the exercises on.